Hi, Instagram. I'm Dr. Michael Mintz, and I'm a psychologist here at Children's National and Associate Director of the Child Development Clinic. I specialize in early childhood mental health and development. I provide developmental evaluations for infants and toddlers, often working with young children who aren't meeting milestones, including children with autism and children with complex medical histories. Today, I'm here to talk to you about the first year of life and development during the first year of life, starting with infancy and working our way up to the first birthday. Let's get started. What's the first question? What does development look like during the first few months of life? So when babies are first born, I think a lot of people feel like there's really not that much that they do. Their brains are really amazing because their brains are ready to learn so much. But on the outside, they don't do very much. One thing that they do really well, and what's really most important when they're first born, is that they feed, they suck. And that's why babies, when they're really upset, the one way that they soothe is just by sucking on a pacifier or the bottle or nursing. And so hopefully what newborns do really well is they suck and they eat. And the reason they do that is because in order to survive, you really need to be able to eat as a baby. And so for the first few months, that's what they do best. And I think a lot of people would say, other than that, they don't do a whole lot. They obviously make dirty diapers. They cry and scream and yell. They let people know when they're hungry and when they're angry and when they need something. Some parents would say maybe they cry a little too much sometimes, not only when they're hungry, but that's often what you see in the first few months of life. And then by around 2 months, what we often see and what we're often looking for as developmental specialists is what we call the social smile. Babies often start to show that smile at 2 months, not just smiling because they're passing gas or smiling for kind of no clear reason, but smiling because they're looking at a parent's face and smiling sometimes because a parent smiles at them. And that's really important because it kind of leads to what we think is really important in the first year of life, which is social development. And we're going to talk more about that as we get later in life. So around 2 months of age, we're looking for that social smile. Another thing that we start looking for is more kind of a motor output, the motor skills developing. And when we talk about motor development in the first year of life, one way to think about it is it kind of starts at the head and works the way down to the feet. So the last thing that kids do during that first year of life, or 14, 15, 16 months, is start to walk. So that's when they're getting their feet involved. But during the beginning of that year of life, that first year of life, we start to see development up here, which basically means they're controlling their head, they're moving their head, and you can pick them up and they can control their head a little bit better. And so by 2-3 months, you're seeing pretty good head control. By 4 months, it's not just the head, but this part of the body starts to come into play. Their shoulders, their arms, even their hands. 4 months of age is often when we first start seeing kids for outpatient developmental evaluation, so doing really more thorough testing. And that's often, as I said earlier, kids with complex medical histories that put them at risk of developmental challenges, things like prematurity, or other things that might get them hospitalized or require surgery in the first year of life. So when we see them at 4 months, one thing we're looking for, I already kind of talked about this, is using their hands. And what we want to see is on their back, reaching for things right in front of their head, and maybe even bringing the object to their mouth and sucking on it. At that age, they're still relying on that oral mouth kind of sensation to soothe when they're upset, or obviously when they're hungry, because they're still nursing or taking the bottle as their primary form of nutrition. So at 4 months, we're looking for that reach. We're looking for some of the social skills I already talked about, like smiling in response to a face, or looking for parents' faces or voices even from a distance, turning to a voice. At 4 months, we're starting to see some other motor skills like rolling from their back to their side. By 4 or 5 months, really rolling all the way to their belly, and maybe from their belly tipping back over to their back. On their belly, what we call tummy time. Tummy time is a really important skill to be working on in this 3, 4, 5 month range. Tummy time is where kids are starting to develop that strength up here. So instead of just laying flat on their bellies on their bed, they're kind of looking up and straining and even pushing with their arms and hands so that they can see what's going on and get their head up. And the strength that they're using in here, you can see we're kind of moving down from the head towards the feet. The strength that they're developing in their chest and arms and shoulders, and eventually their torso, that core strength. Those are things that are really going to help them as we get towards the big motor milestones that start to come around 7, 8, 9 months, which I think gets us to our next question, which is, what are some things, some big changes that take place during the middle year, the middle of the first year? So as we're getting to 5, 6, 7 months, we're working on that strength in this area. In terms of motor skills, kids are not just grabbing toys and bringing them to their mouth, but they're also grabbing toys and exploring them in a sensory way. They want to know what it feels like in their mouth, what it tastes like, really more what it feels like in their mouth. They want to kind of shake stuff and even start to bang stuff. So by 6 months, kids are grabbing toys and banging them on the tabletop. And if you're sitting with them at the dinner table, they're kind of grabbing things off the dinner table, causing problems at dinner, which is a good thing to see at 6 months. On the floor, hopefully they're rolling and starting to play with toys on their tummy. At 4 months, a lot of kids really don't like being on their tummy because it takes a lot of work to push up and get up from that position. But by 5 or 6 months, hopefully they're playing with toys on their tummy and rolling because they're trying to get a toy. And what we often see is that they really don't like being on their bellies until they get better at playing with toys. And once they start playing with toys, that's when they're really kind of happy on their belly. By 6 months, hopefully sitting up so that you can kind of put them there and they'll start to develop that strength in their core to sit up. But what I really want to focus on now is as we're getting towards 7, 8, maybe even closer to 9 months of age, play starts to shift. When you're 8 months, you're still kind of banging blocks, but by 9 and 10 months, kids are really starting to explore toys and see not just what they feel like, what they sound like, but how they work. And what the first way we see that is container play. By 9 or 10 months, kids are starting to show an interest in container play, which basically means block goes in the container, block comes out of the container. It's the first thing that that babies do where they're starting to see how two objects go together. That's why it's important, and it's what we call functional play. So that's a big milestone that is more sort of cognitive and play and figuring out how things work, exploring their environment and kind of figuring things out. And that comes around 9 or 10 months. Obviously, in terms of motor development, a big thing we see is crawling and maybe even starting to pull to stand, maybe even cruising, which is holding onto the furniture and taking steps. And those are really big, important motor milestones. But in my work, what I'm often doing is directing parents' attention to some of these other less visible milestones. It's not just about crawling and walking, but it's about some of the cognitive things that we talked about, play skills, figuring out how things go together, social development. And what we often see by that age is hopefully some simple imitation, like clapping, maybe even using some gestures like waving. And those social skills, we started talking about them all the way back at 2 months of age with the social smile. By 4 months, tracking parents and being excited to see them, maybe even cooing back and forth. So baby makes a noise, mama or dada makes the noise back, baby makes the noise back at them, the back and forth of that. And by the time we're at 7, 8, or 9 months of age, we're starting to see that reciprocal back and forth exchange in terms of babbling and making noises back and forth, in terms of imitating simple gestures like clapping and waving, so that by 9 months of age, they're imitating lots of simple gestures like that, and they're doing lots of back and forth, and they're making good eye contact and letting parents know when they want to be picked up by lifting up their arms. So what's really important at 9 months is not just the motor skills, which are important, but not the only thing, but some of the social skills and social communication skills. And this is where we start to get into language development, not so much what children say, because at 9 months, they're babbling, hopefully, ba, 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 ma, 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 maybe not necessarily using those as words, but they're babbling. But by that age, they can really understand language. And so what we're looking for at 9 or 10 months of age is understanding a few simple words. And what we really encourage parents to do to work on that is using simple words and repeating them, before they do a routine, before they give them an object, before mom or dad walks in the room saying, I think I hear mama, where's mama? And then she walks in the room. Or before giving the bottle, where's the bottle? Where's the bottle? Here's the bottle. So repeating it before doing it so that the babies are really paying attention to the language before they see the object. So as we're getting up towards the first birthday, which I think is our third question today, what should parents focus on as they're approaching that first birthday? I think a lot of parents really focus on motor skills, getting my kid to walk. Walking does not need to happen at the first birthday. Oftentimes doesn't come until 14, 15, even 16 months of age is within normal limits for starting to walk. And when I see kids who are not yet walking, let's say at a 15-month visit, I'm far less concerned if they're meeting those other milestones, if they're doing everything that we expect to see from a social standpoint or from a social communication standpoint, not just waving, but pointing, and also from a kind of problem solving and play perspective, engaging in functional play routines. So those are some big things that I often help parents kind of focus on. Not just on kind of the more visible and clear things like walking and talking, but problem solving play skills, receptive language skills, and social communication skills. Those are some big things that I focus on. And I think we have one more question today. When should parents get their child evaluated? When should you be concerned? So I think we talked a little bit about this, that it's not just about meeting those motor milestones. It's about those other kind of less obvious milestones. Obviously, a good place to start is talking to your pediatrician. We want every parent, hopefully, to feel comfortable talking about these developmental concerns with their pediatrician, and also thinking about these other sort of domains of development, not just focused on getting my kid to walk or getting my kid to talk. We're far less concerned about a child having, let's say, slightly delayed or immature motor skills if they're meeting their developmental goals in those other domains, using their hands in play to solve problems, understanding language, and engaging and communicating socially. But we obviously want everyone to feel comfortable talking to their pediatrician and asking whether their child should be evaluated. If not, please contact, or even if the pediatrician does have concerns, we want you to feel comfortable reaching out to our clinic. That's the Child Development Clinic at Children's National, where me and my colleagues are happy to answer any questions that anyone might have.